on the 3 ballot questions. My name is Michelle Kulik, and I'll be your moderator for tonight. Today happens to be the National Voter Registration Day, nationally. So it's very appropriate that we are considering 3 questions that will appear on the Massachusetts state ballot on Election Day, November 6th. These 3 ballot questions are very controversial, they're very confusing, and we hope we will all be better informed at the end of our forum tonight and be ready to vote on them in November. This forum has been organized by the Manchester Democratic Town Committee, but not as a partisan activity, but as a way to be informative and educational public service to help us all understand these ballot questions. And I wanted to thank the Democratic Town Committee members who have made it possible with refreshments and helping with the organization. I wanted to thank Kathy and Peter Burns, Christine and Jim Gagney, Allison Ann Holt-White, and I'd also like to thank Sandy Bodmer-Turner. And we really appreciate all their help. I'd like to also thank the Manchester Community Center for graciously allowing us to use their lovely building as our venue. And I'd like to thank the Community Public Access TV channel, 1623 Studios, and their cameraman, Tim Evans, for taping this event and for putting it on TV in October. I wanted to also thank all the speakers here tonight. We have 3 speakers already and 2 more are on their way. They have prepared remarks and some of them have traveled quite a distance. Most are volunteers like we are, and we appreciate their commitments to their causes and willingness to share their opinions and research with us. Now for the process. This is not a normal formal debate, but we want to hear each side. We'll take each ballot question in turn. I will introduce the next speakers and read the text of the ballot question. Then each speaker will have 10 to 15 minutes to make their case. First, yes, and then the no. Then there will be 10 to 15 minutes of questions from the audience. Then the next ballot question will be considered. I ask the speakers to repeat the question from the audience to ensure that the question is picked up by this single microphone that we have here. Ready? Let's go. Ballot question number 1. Do you approve of a law summarized below on which no vote was taken by the Senate or the House of Representatives before May? This proposed law would limit how many patients could be assigned to each registered nurse in Massachusetts hospitals and certain other healthcare facilities. The maximum number of patients per registered nurse would vary by type of unit and level of care as follows. I'm not going to repeat what's on the yellow form that is from the State Department, the Commonwealth Secretary of State's office, but it's out there on the table. This whole first page is ballot question number 1. It's very specific on the limits of numbers of patients per nurse, per type of medical facility. And let's see here. The proposed law would require a covered facility to comply with the patient assignment limits without reducing its level of nursing service, maintenance, clerical, professional, and other staff. And it goes into many other things too, including a penalty of $25,000 per violation for each day a violation continued. And then also the proposed law would take effect on January 1st, 2019. A yes vote would limit the number of patients that could be assigned to one registered nurse in hospitals and certain other healthcare facilities. A no vote would make no change in current laws relative to patient to nurse limits. And first we have Janine Burns. She's going on the yes on number 1. She's a recently retired registered nurse. She worked at Addison Gilbert Hospital in Gloucester for 24 years. the last 18 of which was in the emergency room. She's a graduate of Endicott College, and she lives in Gloucester. This is Janine Burns. The no position is represented by Ashley Waddell on the right. She's an RN and has been an RN in Massachusetts for 17 years, 15 of which were at Boston Children's Hospital. She has a BA from University of New Hampshire, an MA from Northeastern, and is a PhD candidate in nursing and health policy at UMass Boston. She also was a Jonas Nurse Scholar from 2016 to 2018. Janine, would you like to go first?
Okay, thank you very much for having me here. Nice to see you all here tonight. This is a very important question to me, and I am voting yes. I'm sorry? A little hard to, okay. Okay. I'm voting yes on this question because this is a very important issue for me as a nurse of over 4 decades, because I have seen what is happening right now in hospitals because we do not have the proper number of nurses to take care of patients at times. Some hospitals are in compliance right now. Some of the hospitals in Boston are in compliance with the numbers that we're suggesting. But right now, I think it is so very important that we have this yes vote, because currently there is no law to hold hospitals accountable for providing the nurses to take care of the patients that are in the hospitals. Nurses right now can take care of any number of patients, and we literally have no say in this. That comes down from administration. They decide, and they decide by numbers, not by acuity. And for 20 years we have been asking for them to have an acuity tool so that when you go into a unit, say a med-surg unit, your nurse doesn't have to take care of more than 4 patients, because that's the number of patients that we feel would be safe for a med-surg unit where you possibly just had surgery. Same thing with the emergency room. There's any number of patients that I could be taking care of on a normal day in the ER. Although there really are no normal days in the ER because it's a very fluid unit where the census changes by the minute. But you know, it's not safe for me to have a critical patient and 3 other patients. You know, so if I have a critical patient, if I have, say, for instance, 4 patients, and one of those patients becomes critical, or I have 3 patients and a critical patient comes in and I need to take that patient because I'm next in line to take that patient, I cannot safely take care of a critical patient and 3 other patients that I originally had. That cannot be done. So another nurse that I'm working with has to absorb my patients, even though she has her own patients. Well, that's just not safe. And things are getting missed, medication errors are being made, and people, patients, and their families, I feel, are not getting the care that they deserve. We're all paying a lot of money for our insurance every month when we, you know, have to pay our insurance bills, but we should be getting the care that we deserve as patients, because now I'm speaking as a patient, because I myself, you know, I'm at the age where I'm, you know, have had some issues. My husband has had many issues. He's been in the hospital many times. And in the hospitals where we have not had the amount of nurses that we need, his care has suffered. So that's why I'm saying yes on number 1, because, and I believe that the hospitals can afford this. That's, you know, right now the hospitals are making millions of dollars in profits. And so that's why I believe that they can afford to pay for the nurses, the increase of nurses that we need to have. And we have the nurses out there. Massachusetts graduates over 3,000 nurses every year. And those nurses are looking for jobs. And nurses are leaving the bedside because of the added stress that they're dealing with having to work at the bedside with too many patients. So I believe that nurses will come back to work that have retired early or left the bedside because of the added stress of taking care of too many patients. And in California, this has worked. This law was not exactly this law, but a law was passed to limit the number of patients that a nurse could take care of. And that was instituted in 2003, and that has worked. And that has shown universally that it has worked and the care has been provided in a better way because there are more nurses to take care of the people. And so that's another reason that I really think that this law must pass. Excuse me, I'm just going to look at some of my notes too, because there's so much information about this bill that is very confusing to people. We do not have the millions of dollars to put advertisements out on the TV. So we are going door to door and making telephone calls, telling people why we think that we need to vote yes on this bill. So in terms of monies and hospital profits, I also want to bring this up. One of the points that the advertisements are addressing on the television are that we can't afford it, that will cost $1.1 billion annually. Well, that we don't find is true. The independent studies that were done by a Judith Sheendahl Rosenchild, who is a professor at Cornell School of Nursing at Boston College, did a study that came up with a cost being, say, $47 million versus excuse me, was it 47? Well, much less than what they're saying it will cost. So that's another reason that, I think that we need to vote yes on this. And the hospital executives right now are generating more than $28 billion in revenue each year. That's $28 billion in revenue each year. And hospitals have posted a surplus in excess of $1.1 billion annually. So I believe that they can well afford to put that care at the bedside. If in California they put 3% of their projected budget towards hiring these nurses, and they were able to do it. They said, oh, well, your hospitals will close, your community hospitals will close. We won't be able to treat patients. Well, no hospitals closed in California since this law went into effect, and patients are getting treated. And in this state, we have an EMTALA law in the emergency room. Any patient that comes to the emergency room must be seen. We do not have a diversion law anymore in this state. So we will treat every single patient. And if people come in and it's a disaster or there's a flu epidemic, of course this law is going to be flexible, and you're not going to be fined $25,000 a day for not having the amount of nurses per patient, because that's not practical. So that is not the truth when they say that hospitals will close. And if hospitals do close, it certainly won't have anything to do for putting more nurses at the bedside. It will be because of the budget proposed by the federal government to cut Medicaid funding. And that's another big issue that has to be looked at, I feel, really, in order to ensure that we have good, safe patient care. Right now, nurses in hospitals aren't getting breaks at all. They're not getting lunch breaks when there's not enough nurses, because they can't. They can't leave their patients and go to lunch, because who's going to take care of their patients? There's no backup. There's no lunch break nurse. There's the charge nurses in the hospitals, at least Addison Gilbert and Beverly, which is now run by Leahy, they, even their charge nurses have to take care of patients. They have a full load, so they can't help us when we have a problem. So what has to happen is they have to provide, I believe, a charge nurse that just helps out when the census climbs, or to give a lunch break to nurses, so that, you know, they can better take care of the patients. And the nurses aren't going to be held accountable either. I know that this is a big problem that evidently nurses are worried about, that if they take on, say in the emergency room, 5 patients when they're supposed to have 4, that's not, they're not going to be accountable for that, because it's the administration's job to find those nurses and to provide us with those nurses. Right now, we don't have the autonomy to make the decisions at the bedside when we need more nurses. When we're overwhelmed in a unit, whether it be a med-surg unit, maternity unit, ER unit, no matter where it is, we can call and ask for help, but they're not going to provide us with help because they don't have extra nurses. You know, but they need to have this, because if one person calls out, there's no replacement. And so what's happening now is nurses are being mandated to work double shifts. Well, that's not safe either. I mean, and we passed a law that you can't mandate nurses, but guess what? There's no teeth in that law. There's a law against mandating, but there's no teeth in it, so they just keep mandating. So that is why we had to make this law where there is a fine if you continually violate it. Now, the nurse is the one that's going to report that she didn't have enough nurses to take care of the patients, so she's going to generate that report that the hospital is not providing enough nurses to safely take care of the patients. So it's not going to be like if all of a sudden a nurse calls out and you actually have more patients than you should have because they haven't found a replacement for you. It's not going to be the nurse's responsibility, it's going to be administration's responsibility. And currently there are not enough per diem nurses. They are not hiring enough per diem nurses. And there are 3,000 nurses graduated every year from our nursing schools here in Massachusetts. And we graduate, I believe there's only one other state in the country that graduates more nurses than us, and I believe it's Arizona. So I think the nurses are out there. And so I think that they can well afford to hire the nurses to take care of the patients, because we all deserve that care when we go to a hospital. And just to be able to spend time teaching your patients, you know, that's a big problem. Is patients are sicker now, they're coming into the hospital, they're staying less time than they used to stay. In 3 days, you're supposed to teach them and get them ready for discharge and teach them their discharge instructions. When you have many, many patients, that's very difficult to do. It's extremely difficult. But with the right amount of patients to nurse ratio, we feel like we will be able to teach you. You know, we're sending elderly people home, and maybe they're taking a diabetic shot that they've never had to take before. And we're supposed to teach them that in 2 or 3 days. We're supposed to teach them about their medications and what the side effects are, which are many for all medications. You know, we're discharging and then doing admissions, one on top of another, one on top of another. Sometimes nurses can see 8 and 10 patients in a day between the admissions and the discharges. So the bottom line is there are not enough nurses to take care of the patients in the hospitals. And I feel that the hospitals have the monies, have generated the millions and millions of dollars of profit to put the money into the nurse at the bedside.
Thank you very much, Janine Burns. And now we'll listen to Ashley Waddell.
Thank you. It's my pleasure to be here this evening on behalf of the Coalition to Protect Patient Safety to provide a perspective on the No campaign for question number 1. So you may have gathered from the brief bit of my bio that was shared with you, I am passionate about nursing. I've invested a lot of time and effort and energy into my education to be prepared not only as an excellent clinician, but also as a trained scientist. So a lot of what I'm going to share with you today is data. I have references that I'd be happy to share with you. It's unfortunate that I can't show you my slides, but I would be happy to show you them afterwards. So you're going to have to tolerate me speaking through some data points that you're not going to be able to see, but I think we're going to be able to do just fine. So without further ado, so the Massachusetts Nurses Association is advocating the yes position on this ballot question. And just to be clear, it would set in place mandatory minimum nurse staffing ratios on all units in all hospitals at all times. There is no flexibility in this law, and it disregards local circumstances. So I'm just going to ask you to reflect quickly on what took place up in the Merrimack Valley about 2 weeks ago when there's an influx of patients heading into the emergency room. That does not constitute a public health emergency. That's what would need to be declared. So the last time a public health emergency was declared, it was when Deval Patrick declared the opiate crisis a public health emergency. So, I don't know how that helps in this situation, but the flu, major snowstorms, massive car accidents, this incident with all of the gas explosions, none of that is going to lift this rigid structure, this rigid set of requirements and mandates from the hospital settings. And I think you'll start to understand how that poses problems because everything in healthcare is fluid. There's very few things that operate on a strict fixed protocol. So this initiative is going to create an unfunded mandate. There is not a pot of money coming along with this. Our federal dollars from Medicare, Medicaid, none of those payments are going to increase. But hospital costs are inevitably going to increase. So where does that money come from? It's going to get translated back and pushed onto consumers. You're going to see it in higher insurance premiums and higher insurance costs. This is going to tie the hands of well-educated professionals, and I would like to stress that, nurses are both well-educated and professionals by imposing these rigid at all times ratios between registered nurses and patients. And as we understand, there's going to be a fine associated with every time that there's an incompliance with this law. And it's a fine of $25,000 per incident per day. That could accumulate to be quite a lot. So the bottom line is ratios are going to be costly. There's no guarantee of improved quality. And it runs counter to the work that we've been doing in this state to align healthcare payments and reimbursement with quality patient outcomes and with patient satisfaction. So the Massachusetts Nurses Association, they are the proponents on this bill. They represent less than 25% of the nurses in this state. They have proposed this policy idea in one form or another for the past 20 years, and legislators have rejected this idea because they understand the very significant unintended consequences that are going to be felt by patients, by communities, by hospitals, and by the state as a whole. So we heard that California is the only other state in this country to have passed mandatory staffing ratios. It was passed in 1999, and they had 5 years to implement. There is no evidence that care has improved as a result of it. I will share some of those findings with you. And in 2016, there were 34 fewer acute care hospitals in California than there were in 2002. Hospitals absolutely closed. Several other states have considered this and similar mandates, all with different numbers, which I think would suggest to you that perhaps these numbers are a bit arbitrary. And all attempts have been rejected. So I want to speak with you a little bit about healthcare quality and what we know about healthcare quality. So when we look at Massachusetts versus California, Massachusetts outscores California in almost all domains. This includes mortality, infections, patient safety, ER wait times, patient satisfaction. California falls below Massachusetts in all of those domains. They're measured consistently and reported publicly. In terms of overall clinical performance, these are all other indicators, and in every single case, Massachusetts is again higher than California. Overall performance at hospitals, prevention and treatment, 30-day hospital mortality, infant mortality, hospital discharge instructions, patient-centered hospital care, and overall grading of hospital systems. So Massachusetts has outstanding hospitals. They are world-renowned. People come from across the country, across the world, to have care here in Massachusetts. We have a lot to be proud of, and there's very little evidence to suggest that what California is doing would get us anywhere, and in fact, it may put us on a course to derail the work that we are doing. I want to speak quickly to the issue of hospital discharge, because that's something that we just heard the proponents suggest. So Massachusetts ranks 7th in preparing people for discharge. California ranks 43rd. So I would suggest to you, if mandatory staffing ratios that have been in place in California for 14 years was like the special sauce, the winning ticket to preparing people for discharge, they would not be sitting at the bottom of the heap. They are literally 7th from the last in terms of across our entire country on that measure of quality. So if mandatory nurse staffing policy alone was the essential component to improve patient care, I would expect to see the evidence in California's outcomes, and it just isn't there. And this is important because when you ask yourself, what is this ballot question going to solve? What is the investment? What is, we know it's going to be a tremendous financial investment. What is the return on investment that we could expect? We have to be asking ourselves those questions. And from the perspective of the data, it just isn't clear. So in terms of hospital margins, we have 68, 69 hospitals in the state. There are currently 14 of those hospitals that are operating with a negative margin. So just like your own, household finances, it's no different, right? Operating on a negative margin is not sustainable, it's problematic, and it means tough decisions are probably gonna have to be made. If this law were to go into effect, we are going to add 25 hospitals into that bucket of operating with a negative margin. That puts 39 hospitals out of our 68 total below, at a negative operating margin. So we have a lot to be concerned about in terms of the risk that we're putting our hospitals up against when it comes to this ballot question. I already mentioned the fact that 34 hospitals closed in between 2002 and 2016, and that hospitals in California were more than twice as likely to close than hospitals in any other states during that same period of time. There's also new research coming out of the University of Pennsylvania that indicates a causal relationship between the California nurse staffing law and hospital and emergency department closures. We're also really concerned that communities are going to be affected by this, and patients as well. So right now, there's been a lot of efforts underway to push care into the communities, right? So to deliver care in settings outside of a hospital. So you need nurses in all of these settings to make that happen, whether it's doctors' offices, home care agencies, visiting nurses, ambulatory care centers, rehabilitation centers, assisted living, substance abuse treatment centers. Hospice is a big one, school-based health centers, and then academia as well. So we're making sure that we're preparing a pipeline of nurses for our future. So all of these nurses function outside of a hospital environment. We need them in place there, and there's very significant concern that implementing nurse staffing ratios and causing an increased demand for nurses in the acute care setting is going to pull nurses out of the community, and that's actually going to make it harder to keep patients at home, keep care, close in communities to where patients live. So hospitals, it's unlikely that they're going to be able to fully ramp up to comply with these mandatory at all times ratios on all units, given that there's 37 business days between the day we vote on it and January 1st. So if we are unable to fill those vacancies, what are organizations going to do? Possibly they could redeploy nurses from other parts of the organization. That's a possible strategy. The other is they're going to have to suppress volume or suppress, the beds in which they are able to care for patients. There's only two ways, there's two ends to move on this. So either you have enough nurses or you take care of less patients. That's how you comply. And that causes, a significant challenge for people seeking health care. I want to speak a little bit to this idea about how many nurses are available to work in our state. We know that there are 1,200 vacant nurse positions as we speak right now. If this law were to pass, we would bring that up to almost 6,000. So the question is, where are these nurses going to come from? Massachusetts has the highest percentage of nurses over the age of 50 and the smallest percentage of nurses under the age of 40. So we have a pipeline problem as it is without adding this to the mix. From working with colleagues in other states, I can assure you that they are extremely concerned. New Hampshire, for one, already loses 5 to 8% of their workforce crossing over the Massachusetts border to work in Massachusetts. If this were to pass, they're very concerned about what it would mean for nurses in hospitals and patients up in New Hampshire. So if we have to suppress beds, I have a really interesting slide talking about what that's likely to look like across regions in Massachusetts. And just to highlight where we are in the Northeast Seacoast region, the expectation would be access to care would be suppressed by 27%. So you're essentially removing a quarter of the care we're able to deliver right now because we're not going to be able to fill those RN positions. So that means, I have parents who need health care a little bit more frequently. They have received tremendous care at Anna Jake's Hospital. And perhaps if the nurses in that area have reached their ratio, that means that they are going to end up at a different community hospital where their records don't belong, with doctors who don't know them. And you start to wonder, what does this mean for me? And again, I'll bring you back to the question we asked earlier. What problem are we trying to solve? What investment are we willing to make? And are we sure we're going to get a return for our investment? I want to move towards wrapping up by talking a little bit about the behavioral health space, the mental health space. So there was a report released in August by the Massachusetts Association of Behavioral Health Systems. It was reported in the Boston Business Journal. Many of you probably saw this. But they project a 36% decrease in the number of mental health beds because they are not going to be able to find enough nurses to keep beds open. That is a loss of 1,000 mental and behavioral health beds across our state in a time when we have an epidemic going on around opiate abuse and addiction, and we need those behavioral health beds. So this is a vulnerable population, and this is an area that we would be watching to be significantly hurt by this ballot question. So I just want to summarize by saying that I think that there's many layers of unintended consequences that are going to come with this ballot question. On the patient side, we're going to expect excessive wait times for patients in emergency rooms. This has happened in California. It is not uncommon to see ambulances lined up, essentially waiting for a nurse to be available. So if there's no nurse available, you're sitting in an ambulance and you're getting your care there until one is available. We're going to see decreased access to health care. We've talked about that in a few different ways. And then increased costs. On the hospital side, if hospitals are unable to hire the nurses needed to fill this mandate, there's going to be a decrease in services offered. There's going to be an inability to invest in innovation and technology. Just think how fast healthcare is changing, right? This is headline news constantly. There is so much going on in this space. We can't even imagine what it's going to be like, probably 5 years from now. And this is a proposal that is going to set in stone a fixed required ratio for nurse to patients at all times in all hospitals. It will cause a decrease or elimination of support staff. This would be most likely our lower wage earners, because the money has to come also from somewhere. And if we have to hire all of these RNs, it means we are going to have fewer nursing assistants, fewer other healthcare providers in our space in order to meet this mandate. And it will likely lead to some hospitals closing. I think the impact to communities is going to be fewer nurses working in home care and in community-based settings. That's going to make discharging patients out of the hospital more difficult. Rehabilitation centers and healthcare centers and schools are in the same boat. They're extremely concerned about this. We're likely to see increased burdens on small businesses. The people who are trying to provide health insurance to their employees, they are going to feel this very significantly on the side of healthcare costs and premiums. And then there's likely to be loss of jobs in a community if a hospital closes. And these could be jobs that just have a relationship with a hospital that get traffic from the fact that there is a hospital in that area. And then on the side of nurses, this is going to leave nurses with less flexibility to treat the unique needs of patients. So patients are unique. They have a lot of unique needs, and nurses are unique. They have different skill sets. And the magic happens when you're able to take the skills of a nurse and pair it with a patient, and there's a really good match. So calling everyone even and just based it solely on numbers is oversimplified, and it's just unfortunate and a bad approach to try to remove the critical thinking of really smart, well-prepared professionals. I also want to emphasize that, nurses are only one part of a healthcare team. And, I love them, this is what I do, but we are just one part of a bigger whole. And I think it's going to set a system off in imbalance if we're overemphasizing one care component. And we're assuming that, say, what you need on a pediatric unit at, say, Anna Jake's Hospital is going to be the same as what we need on a pediatric unit at Boston Children's, where I spent, the bulk of my career. I just think it's a one-size-fits-all proposal that does not make a lot of sense. And from my own professional stance, I worry about losing control over my practice. And I think it's going to interfere with interdisciplinary collaboration. So on behalf of the Coalition to Protect Patient Safety, I hope I provided you with some information to possibly stimulate your thinking or help you, approach this issue with a little bit of a different lens. I'm here on behalf of fellow nurses. The American Nurses Association is with us on this. The emergency room nurses are with us. Med-surg nurses are with us. Infusion nurses, it goes on and on. We also have the ER physicians. We have Massachusetts Medical Society. We have the Home Care Alliance. So healthcare professionals across the continuum, across disciplines, are raising their hand and saying, hold on a minute, there are some very significant concerns and possible consequences associated with this proposal. So thank you for your time.
Okay, now we have some time for some questions. Go ahead.
I have some questions for Noe, I want. Do you, just about data and some of the information you presented, you were comparing California and Massachusetts, and really, they're such different states in terms of the composition of the population, the size of the state, all of that. Do you have any data on California, the measures you used in patient satisfaction before the law was passed and after the law was passed?
So this law was, do you want me to start or do you want me to say more?
Well, that's
a chunk. We can do that chunk. Okay.
Right.
So this law was passed in 1999 and was implemented in 2004. So that goes back a while. And this gets to the point of what has changed in that amount of time. And the truth is a whole heck of a lot has. So I don't have that data in front of me, but I would just say that the commitment to having standardized data sets across the country to allow for such comparisons to be possible has been increasing over the last decade. And so some of these metrics, I can't speak to exactly how long we've been tracking all of them, but I'm just not exactly sure that that's going to tell us a whole lot.
Well, it's both California before and after. That's what I was looking for. But if you don't have it, that's fine. In terms of the forecast about the likely need for nurses,
Yeah.
a shortage, currently you say, which is 1,200 a year,
Yeah.
which you say will balloon to 6,000.
That's correct.
In the model you use to forecast those numbers,
Yeah.
what are the assumptions that you make about what hospitals pay nurses?
So I'm going to see if I can get this exactly right, and I may be like an IOU on some data points. But the assumption is that wages are going to rise between 8 and 10% as hospitals begin competing for RNs. So that's what they saw take place in California when they were going through this. What was the other piece you asked about?
I was just trying to understand when you're forecasting, I think you answered the question.
Okay.
So you're assuming hospitals are going to pay 8 to 10% more a year to nurses, and there will still be a shortage of 6,000 nurses a year?
Yeah, so it's not So the assumptions made on the other side are that, say, me, right? So I spent 15 years working in a clinical environment and I'm not doing that right now. So the assumption is two pieces. One, that I left because I felt that the ratio, you know, that I wasn't well supported in the clinical environment and I couldn't tolerate working there anymore. That's not true. The second assumption is that if this law passes, that's going to be my job of choice and that's what I'm going to do. So I think that both of those are faulty assumptions, so that counting the number of nurses in Massachusetts gets really complicated because I still hold a license as a nurse. I just am not working in a clinical setting, right? But so these vacancies, just another piece about the vacancies, they exist in several areas, most specifically operating rooms, emergency rooms, maternity and OB are very hard to hire into. So these are areas that they're pretty highly specialized. It takes a long time to train someone into those roles, and those are the ones that hospitals will say that they typically compete most aggressively for.
Another question?
Yeah.
Go ahead.
I have a two-point question. First, when you mentioned the 34 hospitals that were closed, what percentage of those hospitals have been absorbed in the same manner that we've seen right now in Massachusetts, where partners is in competition with Leahy, who's gobbling up whatever they can find? So can you answer that? And also, you mentioned causal factors because of the law. What specifically are those causal factors that made you come to that decision, or made your group come to that decision?
Like what adds the financial burden to organizations?
Yes,
Is that
the
essentially?
specifics of it.
So I think it's, so there is a financial model. Let me just get to it really quickly. So let's do the first part of your question first, which was, are hospitals, did it account for mergers and acquisitions, essentially?
Yeah, how many of those were actually,
So
doubled up?
I can say this, I'm not going to claim to be the keeper of all truths on this, because I think that there's a lot of things moving, but a lot of those mergers and acquisitions came about as we're changing the way we're paying for healthcare. We're making organizations accountable, so accountable care organizations, you may have heard of that, but you're making them accountable for the health and well-being of a population, and essentially they get a pot of money to pay for healthcare. So if your population is healthier, you keep a bigger piece of the pie. If your population is more sick, then you invest more of it. So it's in order to allow systems to disseminate care across like a continuum.
So you can't tell me which percentage of those hospitals had been acquired by larger groups?
So I guess I'm saying I don't know if the trend of acquisitions was quite as lively 14 years ago when this took place in California as it is right now. And I'm saying I believe that to be the case because a lot of things around healthcare payment reform have taken place in that window of time. 15 years is a long window of time. You had another question that was about the cost. Yep. So there's a lot of things went into the cost modeling, and there was two different groups that did this. We can also expect another word on the finances to come from the Health Policy Commission's cost trend hearing, which is coming up mid-October. So there's going to be another piece of data estimating the cost of this proposal. But it would require hospitals to purchase acuity systems or have an acuity system. It could perhaps be homegrown and not a purchasable item. But most hospitals have some form of a acuity system in place in their ICUs. And if they have an electronic health record, many of them are using that component of the record. They have to purchase essentially like that capacity from the vendor to be able to have an acuity system. So there's dollars associated with that, right? So that's a capital purchase that's going to hit hospitals to comply with the acuity system component of this law. There's recruitment costs, there's turnover costs, there's training and reimbursement, and that's kind of what all feeds into it. It also has projections around, wage inflation that I spoke about earlier.
Okay, we are running out of time, so go ahead, take your.
Thank you.
One comment to addressing your question of what is the problem that we're trying to solve. I think at the root of this is a question of profit in hospitals, in pharmaceuticals, in the whole healthcare system. That's just a comment that is a personal beef of mine. But the other issue that I would like to raise is that legislating nurse-patient ratios is like trying to legislate teacher-student ratios. And there are nurses who can handle 4 ICU patients at a time, and there are other nurses that can't. And to try to get Beacon Hill to tell a hospital or a charge nurse how many nurses he or she is allowed to have does seem to be an imposition that is, as you were saying, very restrictive, and not allowing for the fluidity that is on the ground. And we need to be watching for this in our schools as well as our hospitals.
Yeah, thank you. I appreciate that. I'll just, reflect on the fact that, I'm not here to defend hospital profits, and I'm not here to defend, right? Like, I think that all of, it's fair game, and, I'm not gonna even claim that staffing is perfect in all places. Like, there is work to be done, so, and I'll be the first to raise my hand and say, yes, I'm in, like, let's do the work. My point, and what I hope I can convey to you, is that this just isn't the right path to accomplish it. This is not the right mechanism to rein in, exorbitant costs in healthcare, and this is not the right mechanism to handle, any sort of, problems that may exist in pockets of one organization and maybe not in others.
We'll take
Just
2 questions.
real quick. The one thing I haven't heard you say, I understand that you feel that the law that's being proposed is unwieldy and impractical for many reasons. But the first speaker said basically the working conditions that nurses are experiencing are terrible, and I know this from many other places. What are you going to do about that? Because I can't believe there isn't anything in place that stops nurses having to work double shifts. They have no backups, they have no lunch breaks. I mean, that's unacceptable when these hospitals are so wealthy. And I completely agree with what you said about the dollars flying around in those huge corporations. So this is tying in the profit motive and the working conditions of the
That was
nurses.
my question.
That was your question? Did you have a question?
Point 2, I just don't understand how unions have a place
Yeah.
in nursing. Can either one of you, is it in hospitals, in private settings, like, just where do they have a role?
Well, I can answer that question because I am part of the union. And the reason we organized was because we had no say in the patient care. We couldn't speak up and go to administration and tell administration our concerns about what was going on with the patients. So that's why we organized our union, the Mass Nurses Association. So that's why we have a union. Because if we didn't have a union, we wouldn't even have, we wouldn't even be able to have a 30-minute break, because that's also in our contract.
This isn't sufficient, so you need to pass another law to...
No, we need to pass a law because really the heart of this bill is for patient advocacy. There are not enough nurses in many hospitals right now to take care of the patients that we currently are taking care of. So that's why we need to pass a law. For 20 years, we've asked them to come up with an acuity tool. That's all they needed to do, was come up with an acuity tool to show that if you have a critical patient that's this acuity, say a 4 acuity, then you couldn't take care of any other patients until that patient was stabilized. Or if you had a surgical patient that had a high acuity, you couldn't take 3 more patients that also had high acuities. But they refused to do that. And what their common answer was for 20 years is, we can't staff for the what ifs. But that's what medicine is. That's what happens to you when you get sick. It is a what if. You don't know you're going to be sick tomorrow. I don't know I'm going to be sick tomorrow.
So it sounds like either way, though, healthcare costs are going to increase. you're gonna be overstaffing and.
Well, it won't be overstaffing. It won't be
Because
overstaffing.
you have to, if you don't overstaff, for the what if, you're gonna be penalized.
No, we're asking
And
for,
the patients and the population is going to have to absorb this. The hospitals are not going to decrease their profits. They're gonna just.
well, all it would take was, would be 3%. Yeah, all it took, California was 3% from administration. So it only took 3% for the projected budget in California from administration in order to meet the number of nurses that they now have in California. So, you know, I disagree with that, because really the heart of this bill is advocacy, patient advocacy, because we don't believe that. And although, you know, with all due respect to executives who are expected to echo this position of business, that is their job. Our job is to try to deliver the best care possible, which can be accomplished with more nurses at the bedside. And that's how I feel, both as a nurse and as a patient advocate for my husband, who's been very sick, and as a patient myself.
So just, I'm curious, if someone comes in and you don't have the staff, does everyone shut down, or do you have to wait until someone on call?
No, you will continue to take care of the patients like we always do. But you will only get fined if it continues to happen. They have to come up with a plan. Say,
Within 3 months?
They have to come up with a plan. If they start getting complaints that there aren't enough nurses, they have to come up with a plan. They're not going to be fined $25,000 because I pick up the phone and say, I didn't have enough nurses. And the nurse that has to take care of an extra patient or 2 extra patients, she's going to do it because that's what we do now. But, you know, that's what we're currently doing.
This is not a framework. This is not guidelines, right? Like, this is exactly what it sounds like. It is a law, right? Like, how flexible is the speed limit? How flexible is your tax, you know, like, these are not negotiable. This is a law.
I have to cut off all debate at this time and all comments on ballot question number 1. Thank you so much for being here. Question number 2, and ballot question number 2 is, do you approve of a law summarized below? Okay. This would create a citizens commission to consider and recommend potential amendments to the United States Constitution to establish that corporations do not have the same constitutional rights as human beings, and that campaign contributions and expenditures may be regulated. It goes on to describe it more. A yes vote would create a citizens commission to advance an amendment to the U.S. Constitution to limit the influence of money in elections and establish that corporations do not have the same rights as human beings. A no vote would not create this commission. And we have here today Nancy Hazelton. She's with the organization People Govern, Not Money, which sponsored the ballot initiative. She helped to organize the signature gathering campaign that led to the Yes on 2 question being on the November ballot. Volunteers across Massachusetts gathered over 100,000 signatures last fall and this spring. Nancy is also a visual artist and lives in Concord. So thank you so much, Nancy, for coming all this way.
Thanks, Michelle.
And go ahead and...
So, hi everyone. My name is Nancy Hazelton, and I'm a volunteer with the Yes on 2 campaign. Can everybody hear me okay in the back? Yeah, okay. And so question 2 will address the crazy amounts of money we have cascading into our political system these days, and causing the huge amounts of corruption that are in our government now. Tonight I'm going to give you an overview of what question 2 is and what it will do. I'm also going to give you an overview of the bigger national picture of what money in politics is and how question 2 will fit into that bigger umbrella of what's happening nationally. A yes on 2 vote, or a yes vote on question 2 establishes a nonpartisan citizen commission to advance the policy of Massachusetts in favor of amending the Constitution of the United States to overturn Citizens United and secure government of the people. So that's actually what part of what the ballot initiative says. This citizen commission will consider and recommend to the legislature a 28th amendment to put reasonable control on money in politics and establish that corporations and unions do not have the same rights as people. The commission will be an appointed group of 15 nonpartisan volunteer citizens. This will be no cost to the taxpayers. Across the country, already there have been 19 states and more than 800 cities and towns that have called for a constitutional amendment to control money in politics and rein in corporate rights. Those have been either ballot initiative, town warrants. Those are 19 states and the 800 cities and towns. People have voted on this issue. Question 2 will take this a step forward and establish this first in the country's Citizens Commission. The commission will push our legislature to make a formal request of Congress for this amendment. And with all these 19 states and 800 cities and towns, all these votes, they've voted for this constitutional amendment on the issue of money in politics, and the issue is still really not in the forefront. There's a vote, and then it just kind of goes away, and everybody forgets about it. So the Citizen Commission is designed to keep this issue in the forefront, in the conversation. So in effect, the commission will hold our legislators' feet to the fire, keeping action and conversation on this amendment alive. And so why do we need an amendment to the U.S. Constitution? Right now in our country, money, not the will of citizens, is now the biggest factor determining who gets elected and who has the power in our country. Government is no longer of, by, and for the people. And this has not always been the case, and though it has been an issue in our country, since the very beginning, power takes control and people push back, power comes back, raises back up, and the citizens push back. And back in 1970, for an example, was the first Earth Day when 20 million people came out into the streets, April 22nd, 1970. And out of that Earth Day came national legislation that included the Clean Water Act, the Clean Air Act, EPA. All this response from the government was in a pretty conservative Republican administration. It was the Nixon White House that brought forth all that legislation. The government responded to the citizens back then. They responded to the outpouring of these citizens coming out on the street, 20 million people. And I'm not going to go into all the history of this, what has happened from that Earth Day with the response of the Clean Air Act, the Clean Water Act, and what has happened to where we are now. But it's super interesting, and what I'll just say is that the Earth Day sparked the ire of a group of powerful, sort of corporate-minded people who set out to gain more power for corporations. So slowly, it eroded the rights of citizens and gave more and more power to corporations and entities, artificial entities like corporations, until it sort of ended with the Citizens United ruling in 2010. The Supreme Court said corporations really are people, money is speech, you can't regulate money in politics. And so corporations have the same amount, and big moneyed interests have the same amount of right to put money in elections just like we do. So now that money in politics is not regulated. And so how do we get rid of this? How do we deal with this huge amount of money in politics? So the Citizens United decision and other decisions as well that have led to the law of our land that says corporations have the same rights as people do, and that we can't regulate money in the political system. Money is speech. The First Amendment protects speech. It's unconstitutional to regulate speech and money in political spending. The only way to overturn these laws made by our Supreme Court is with a constitutional amendment, and we, the people, need to be the force to make this amendment happen. And this is a very big push, but it has been done before. And it's usually done in times of upheaval, when people are upset, people are wondering what the heck is going on, and they look around and say, well, you know, what are we going to do about this? Isn't somebody going to do something about this? And we realize that nobody's going to do it. We have to do it for ourselves. And that's what's happening right now. People are looking around and saying, enough, we don't want this anymore. And then, so how do we amend the Constitution? That also is it's a big deal. 2/3 of Congress have to vote on a measure that then goes out to the states, and 3/4 of the states need to ratify that. It is not an easy task, but as I've said, the popular sentiment around this issue that corporations have people and that we aren't able to regulate this big money that's pouring into our elections right now has huge support. These 19 states that have voted on this, and the 800 cities and towns, over and over and over, what we see in virtually all of these votes is that 75 to 90% vote for this. And this is across the board. It's Republicans, it's Democrats, it's independents. It's a very strong base of support across all political beliefs on this one. It's very nonpartisan. There's already several pieces of legislation in Congress that have been voted on regarding this issue. So this is already in flow. And the way that, there are two ways really that question 2 fits into this bigger picture, this bigger national picture of an amendment to the Constitution. First of all, I mentioned that 2/3 of Congress needs to vote on, to get the wording out for this amendment. And it's hard to imagine our Congress right now voting 2/3 on anything, to get anything done. So this really boils down to, we need to put pressure on our elected officials to put this as a really forward, as a really important issue. This is where the Citizen Commission comes in, that's part of this yes on 2 question. The commission will help keep pressure on the elected officials so that we keep saying to them, this is really important, this has to happen. The Citizen Commission will be researching what is happening with big money. It will be writing a report that will go to Congress, will go to the legislature and the governor. Continuing to talk about this issue and put the information out there. This isn't happening just in Massachusetts. We are a little piece of this bigger national pie. Right now in Wyoming, there's a ballot initiative, very much like what's going on right here. Wyoming went 68% for Trump. Again, this bipartisan aspect to this very fundamental issue. Montana, California, Missouri, members of American Promise. There's flyers for American Promise out on the table out there that I left. They're the organization that we're working with that is working nationally to support grassroots efforts like our People Govern Not Money ballot collection, our volunteer ballot collecting, or signature collecting. So what they're doing, what they've helped us, the way they've helped us here, they're also going to these other states, and right now they're in Virginia, as well as other states. So the idea is that we really start to build we start to organize the thoughts that people have that, wow, there is too much money in our political system right now. We do have too much money. We need to do something, but like it's too big. What do we do? The idea is to organize, to get together, and to make a real focused effort of going forward with this, state by state, individual by individual, and really pulling together in an organized way that we can then reach our elected officials in Congress and really start to make this happen. The second way that the yes on 2 vote really fits into this national picture is that the other piece of constitutional amendment is that when we do get it through Congress, it then comes back to the states, and 3/4 of the states have to also vote on it. If all these states have been generating this information about what the amendment is about, what money in politics is about, this is the way we can handle it. All this is being, we've collected all these signatures, like in Massachusetts here. We're talking to people all across the state about what Yes on 2 is happening. When that amendment wording comes through, Massachusetts is ready to ratify the amendment. And as are all these other states who are doing very much the same thing that Massachusetts is doing with Yes on 2 right now. So all these reasons are why I am voting for Yes on 2, and I hope you will as well. Help us out, get out there, and definitely vote. So thank you.
I just wanted you to know that there was no known opposition to this ballot question, according to the Secretary of State's office, so that's fine. Do you have some questions for our speaker? Go ahead.
Hi, thank you very much for your efforts. How many of the states are doing a commission like this?
This is the very first one that has been done. What has been done in the past, if a state can do a ballot initiative, not all states can do ballot initiatives, but if they can do a ballot initiative, they do that. It passes, and then there's really nothing that happens. You can just refer to it, but there's nothing that can happen. So the idea with this commission, and again, this is the first in the nation, which is kind of cool. The potential is really huge to actually have more teeth, to make this issue continue to generate information and conversation in the state, and push the elected officials to advocate for it much more strongly too in Congress and in the state.
My next question is, because it is the elected officials who are going to be picking the members of the commission, and I am feeling probably way too skeptical these days, but and yes, there is a report due by December 31, and but does the December 31 report end the commission's work?
It's a wide open. It's wide open. Nobody knows. It could keep going. It could end it. It could keep going too. Nobody knows.
If the governor and the Speaker of the House, etc., allow it to continue. So there's.
I don't know.
I may be identifying a weakness in the way this is written, and I'm not going to vote against it. Let me tell you. But.
It was written in a way. It was written by very strong advocates for this. It was written by in conjunction with Maura Healey, who helped a lot, and the Secretary of State's office. It was, and with the people who run American Promise, Jeff Clements, Ben Gubitz. They all worked really hard to try to make it as absolutely transparent as possible. In order, anybody can apply to be on the commission. You apply on the website. It's anybody can go and see who's applying. It's more official, I think, because these people are then appointed from that list of people who have applied. It will be appointed by the 5 Secretary of State. I think it's on your yellow sheet.
Yeah.
Who will appoint. They each get 3 people to appoint. So, we're going to see what happens.
Yeah.
It's a question. We don't know. We don't know, but we're lucky. We have a lot of strong support for this this ballot measure in this state. We're really lucky with that.
Thank you.
I feel so supportive about anything that pushes back on the horrible Citizens United decision. My one worry about what you're trying to do, and I just don't have an answer to this question, is if once you open the door to a constitutional convention, do you open the door just on this issue? Can you contain it? Or do you wind up with people wanting to constrain, a woman's right to choose? Do you wind up with people wanting constitutional amendments that restrict voting rights? So do you open up kind of Pandora's box a bit, or do you have an ability to constrain it to the issue of, of money and politics?
Well, the beauty really of the Citizens Commission and the way we're attempting or really wanting to do this amendment is through the avenue of the Congress. I mean, if Congress, what we really want is we want to give Congress the opportunity to push this through and send it back out to the states. We don't want a convention. I mean, a convention is a nasty thing, and I don't think really anybody wants that. It can be a tool to put pressure on Congress. A convention has never been done for the reason that nobody wants it done. It's messy. So the avenue to go through Congress is the avenue that everybody wants to take. So by doing this groundwork of the Citizen Commission, by the ballot initiatives, by all this different work that's happening in the state, to put the pressure on Congress is what we want to do, so that is the avenue that is taken.
Okay, so because you're focused on just doing an amendment, you can contain it to just money and politics.
Well, that's what this amendment is. When the amendment goes through Congress, most amendments, if you go through and you read like the Constitution, the amendments are super simple. They're very basic, like keep money out of politics. They're basic, foundational understanding. They're not really complex. And the laws spin off it after that. So
We have to wind this up.
okay, I hope that's helpful.
Okay.
Okay.
Well, thank you very much, Nancy.
Yeah, thank you.
Is there a yes
Thank you
person
so
on
much,
that?
everyone, for
Who's
staying
that gonna
for
be?
the last section of our educational forum. And we're going to be discussing the ballot question number 3. And the summary of the law adds, this would add gender identity to the list of prohibited grounds for discrimination in places of public accommodation, resort, or amusement. Such grounds also include race, color, religious creed, national origin, sex, disability, and ancestry. A place of accommodation, resort, or amusement is defined in existing law as any place that is open to and accepts or solicits the patronage of the general public, such as hotels, stores, restaurants, theaters, sports facilities, and hospitals. Gender identity is defined as a person's sincerely held gender-related identity, appearance, or behavior, whether or not it is different from the traditionally associated with the person's physiology or assigned sex at birth. This law prohibits discrimination based on gender identity in a person's admission to or treatment in any place of public accommodation. The law requires any such place that has separate areas for males and females, such as restrooms, to allow access to and full use of those areas consistent with a person's gender identity. The law also prohibits the owner or manager of a place of public accommodation from using advertising or signage that discriminates on the basis of gender identity. This law directs the State Commission Against Discrimination to adopt rules or policies and make recommendations to carry out this law. The law also directs the State Attorney General to issue regulations or guidance on referring for legal action any person who asserts gender identity for an improper purpose. The provisions of this law governing access was effective as of October 2016, and the remaining provisions, the ones for gender identity, are effective as of July I'm getting this all mixed up, as of July 8th, 2016. A yes vote would keep in place the current law, which prohibits discrimination on the basis of gender identity in places of public accommodation. A no vote would repeal this provision of the public accommodation law. What we have here two wonderful speakers. We have Dr. Deborah Bradley. She's a volunteer public education action leader on the Yes on 3 campaign. She's the group facilitator for parents of transgender and gender nonconforming children and a parent of a transgender adult child. In addition, she is a physician educator regarding gender affirming care and a fellow of the American Congress of Obstetrics and Gynecology. She's also a resident of Manchester by the Sea. And then on representing the no vote on ballot question number 3 is Andrew Beckwith. He's the president of the Massachusetts Family Institute, where he was previously a member of the board of directors. He's a graduate of Gordon College, which is right here in Wenham, and the University of Minnesota Law School. He also serves as a judge advocate in the United States Marine Corps Reserve, where he holds the rank of major. Prior to coming to the Massachusetts Family Institute, he litigated immigration cases for the Boston office of the Department of Homeland Security. So let's welcome both our speakers. Deb, you have the floor first, and then you. Yeah.
I'm with the Yes on 3 campaign to uphold Massachusetts transgender inclusive non-discrimination law. Transgender equality has been the law in Massachusetts for the last 2 years. On November 6th this year, these protections are up for repeal. Massachusetts voters will face the first ever statewide popular vote on protecting transgender people from discrimination. So I'm going to talk a little bit about who's going to be affected by this law, who transgender people are, a little bit of history on the law, the ballot question, and what we're doing as a campaign. So who am I? I'm a parent of a transgender adult child. I've been a facilitator for a support group for parents of transgender children of all ages. And over the last 5 years with that group, we've had 160 parents of transgender kids participate in that group. I'm also a Massachusetts voter, and I feel very strongly that nobody's civil rights should be put up to a popular vote on the ballot. When I learned that my child was transgender, I was really unfamiliar, like I'm sure some of you are, with what it means to be a transgender person. I mean, what I knew was what I saw in the media, which was distorted and exaggerated. And it took me several years of studying, research, long talks with my child. I met many transgender people, and I met many parents of transgender people before I realized what a challenge it is to be a transgender individual. It's a lifelong challenge. It's a lifelong journey, and it's very difficult. A transgender person is somebody whose body doesn't match who they know inside. So they transition to live as the person they know they really are. According to the National Transgender Survey that was published in 2016, the adults responding to that survey, and these were 28,000 adults from all over the country, reported that 60% of them knew by the age of 10 that they were transgender. They couldn't always articulate it because they were children, but they knew that their identity didn't match how people saw them. 94% knew they were transgender by the time they were 20. Most of them did not communicate this to their family or to anyone until they were in their late teens or until they were adults. The history of the law in Massachusetts is that in 2016, as a state, we updated our non-discrimination law to include transgender people in public spaces. And this meant restaurants, stores, hospital restrooms, locker rooms, public transportation, parks.
And that means now that if you're transgender, you can no longer be denied access to these public places just for being who you are. You know, before this law was passed, you could be a dishwasher at a restaurant and denied service out front. This law was passed by a bipartisan supermajority in our state legislature and signed by our Republican governor, Charlie Baker, in July of 2016. As soon as this update passed, a group of anti-transgender activists gathered enough signatures to put this non-discrimination law up for a repeal vote on this November's ballot. This means that in just 42 days, people across the state will be deciding the future of transgender people's freedom to exist in public places. A yes vote supports the current law and continues to support protections for transgender people from discrimination. A no vote will repeal that law. Who is affected? What's our transgender community here in Massachusetts? The Williams Institute does population-based studies, and in 2015 they published a population-based study throughout the United States, but from that study it came out that in the year of 2014 there were 30,000 transgender adults living in Massachusetts. And that works out to about 2,300 transgender adults north of Boston. This doesn't deal with minors at all. These are the people who need the civil rights protections. In the National Transgender Survey of adults in Massachusetts, 65% of them stated that they had been discriminated against in public places in the past. So that's the community that needs protection. What we're up against is most Massachusetts residents say that they support fairness and non-discrimination protections for transgender people. However, between now and Election Day, anti-transgender activists will be exploiting people's fears about bathroom crimes by flooding media with falsehoods regarding transgender people. This happened in Houston in 2014. In 2014, a non-discrimination order was passed in Houston protecting gay and transgender people, and this was in both employment and public places. And an anti-LGBTQ group was able to get a referendum on the ballot and revoke that ordinance. And it was interesting because when that campaign started, most of the Houston residents, the majority, said that they supported non-discrimination protections for the LGBT community. But after they were confronted with anti-transgender bathroom propaganda, their votes shifted and the ordinance was repealed. So what we've seen across the country is wherever transgender inclusive non-discrimination like ours get passed, the opponents spread fear about bathrooms. And people who say they support non-discrimination start to believe this, and they end up voting against transgender rights. So it's very important. I'm very happy that you're here tonight. It's very important that we have this discussion. You know, all of us care about our safety and privacy in bathrooms and locker rooms and anywhere, including transgender people. As a woman, as a mother with a family of 4 kids, 2 boys and 2 girls, and as a grandmother with granddaughters who are ages 7 and 10, I care about the safety of women and children. I would never support a law that puts anyone's safety at risk, and I would never support rights for my transgender child that would put my non-transgender children and grandchildren at risk. Also, I'm a retired OBGYN physician, and I cared for women of all ages for 30 years. And sadly, a significant number of them had experienced sexual assault and domestic violence. And I would never support a law that would put women at risk like that. The truth is, these protections don't make anyone less safe. A crime is still a crime is still a crime. Anyone who commits a crime in a restroom, locker room, or other place will be arrested, and they should be. And that's true whether they're transgender or not, and nothing in these protections for transgender people change that. Harassment is still illegal. Not once in the 2 years since this law has been in place, or in the many years with this ordinance has been in place in cities in Massachusetts. For example, Boston had transgender protections for 10 years before the state law. Not once has a transgender person entered the wrong restroom or locker room to commit a crime and claimed that being transgender protected them. 18 states have had transgender protections long before Massachusetts. Minnesota has had it since 1993, Rhode Island since 2001, and there was no uptick in their bathroom crimes. We all care about ensuring safety, but repealing basic protections for transgender people doesn't change that. And that's why our state's leading experts on safety support this law. The Massachusetts Chiefs of Police Association supports this law, along with local law enforcement officials. There's a coalition of 40 women's advocacy groups for women who have been victims of sexual assault and domestic violence. They all support transgender protections, and they all support Yes on 3. Also, 2 weeks ago, the Boston Globe published an article that was the result of a study released by the Williams Institute that actually did an academic peer-reviewed study in Massachusetts where they looked at bathroom safety. And they concluded that the state's anti-discrimination law does not threaten public safety at all. As a mother, I want my transgender child protected from discrimination, whether riding a bus, sitting at a lunch counter, seeking medical care in an emergency room, or sipping a coffee at Starbucks. Transgender people just want to go about their daily lives like you and I do. And as a parent, if someone put your child's civil rights on the ballot, you'd be up here with me too. This ballot question, if Yes on 3 fails, can lead to huge economic losses for the state of Massachusetts. When North Carolina passed a highly restrictive anti-transgender bill in 2016, they lost $3.7 billion in revenue the following year. Fortunately for Massachusetts, we seem to have widespread support among labor, business, and 500 faith leaders have come out in support of this bill. And our sports teams, the Pats, the Celtics, the Bruins, the Sox, they all support Yes on 3, and they supported the bill in 2016. People across the country look at Massachusetts on LGBT civil rights, as Massachusetts goes often the way the rest of the country goes eventually. And this is the first time transgender non-discrimination protections are up for a statewide vote. If we lose in November, other states are going to see this as a license to discriminate, and there's going to be a tsunami of ballot questions and bills. This is a slippery slope when civil rights can be taken away by a popular vote. So what are we doing as a campaign? We're just having public education conversations like our conversation tonight. That's the backbone of the campaign. Every conversation can make a difference in terms of winning and losing. You know, Yes on 3 is doing a lot of door-to-door canvassing and phone banks. I'd be happy to have you join me in a phone bank that I run locally. We're planning to win by educating voters about who transgender people are and why non-discrimination matters, so they don't fall for the myths propagated by the anti-transgender activists. The most powerful way to change hearts and minds is with these conversations. So I'm asking you to talk to your neighbors, talk to your family, talk to your friends, talk to your coworkers. Every conversation matters. I have handouts out back, and if you have handouts that you want to share with people, there's a PDF sign-up. Put your email down and I'll send you PDFs of the handouts. I want to thank you so much for coming out tonight to hearing about these ballot questions, and especially this one, because I'm committed to this one. Your vote will allow transgender people to consider living their lives free of discrimination. Your vote will affect transgender people and their families across the state, and ultimately across the United States. When I vote, I'm going to be thinking of my child and all the transgender individuals and families that I've met. And I know Massachusetts will do the right thing, because Yes on 3 is a vote for dignity, it's a vote for acceptance, it's a vote for respect, and for some of us, it's a vote for love. And it's a vote for keeping discrimination out of our Commonwealth of Massachusetts. Thank you for your time.
Thank you, Dr. Brandon. And Andrew Beckwith, could you speak on this issue now?
Be happy to. Thank you. Again, my name is Andrew.
Andrew.
I graduated from Gordon College in 1999 with a sort of poli-sci undergrad and never thought I'd be debating bathroom access, but here I am. I think, I'm glad we're having this conversation. I think we'll actually find that we have a lot in common, Dr. Bradley and I, although we differ on some key points, obviously. But I also want to start with a bit of sort of background and history on how we got to this point with the current law. The law that's on the ballot this November actually go back to 2011. There was legislation then that would have added gender identity to all 5 areas of the state's anti-discrimination law. So education, employment, housing, and lending, and the public accommodations. At the last minute, public accommodations was stripped out because of this concern that that would include public restrooms, showers, locker rooms, changing facilities, single-sex shelters, and the like. So the law that was passed in 2011 did add gender identity to the majority of the state's non-discrimination laws, but public accommodations were exempted. We fast forward to 2016, and that's when the effort culminated successfully to add gender identity to the public accommodations section of the law. Now the reality was, even before this law was passed in 2016, and frankly even before the 2011 law was passed that added gender identity to the majority of the state's anti-discrimination law, folks who have gender identity were protected under state law, and they could file discrimination claims, including for discrimination allegations in public accommodations. One of the most prominent examples, and you can look this up in the New York Times, an article in 2014. Back in 2009, a woman moved to Springfield, Massachusetts, I think from Canada. She was living in Springfield. She identified as male. She'd had both of her breasts removed and had been taking testosterone for a number of years and living as a male, but she wanted to have a baby. She wanted to be artificially inseminated. So she went to Bay State Health out in Springfield and asked to, go through that procedure. And the nurses and physicians there ultimately said, we want to help you. We have a great relationship with the LGBT community. We get great ratings from the Human Rights Commission. But we don't know if we have the medical expertise at this point to artificially inseminate you, given the fact that you are living life as a man, you've had testosterone injections. We don't know if we can do that safely for you or for the baby. We just don't have the expertise. And they referred her to another clinic where she ultimately was inseminated, got pregnant, and had a healthy baby, thank goodness. But she sued back before even the 2011 laws with the Massachusetts Commission Against Discrimination. And they substantiated a claim of discrimination, and ultimately she settled with the hospital. Now, how are they able to do that if the hospital's public accommodation and we didn't have the 2016 law on the books? That's because the Massachusetts Commission Against Discrimination, or MCAD, which is the initial vehicle for bringing discrimination claims in the state, they interpret sex discrimination laws to include gender identity. So gender identity discrimination claims are already covered and have been for years and have been prosecuted successfully by MCAD for years under sex discrimination. Now, the one area where the existing sex discrimination laws didn't cover, where there was an exemption, were single-sex facilities like bathrooms, locker rooms, showers, changing rooms, etc. That's because the law recognizes that it is permissible to treat men and women differently in certain limited circumstances, like those where there is a broad societal consensus that each sex should have its own private space. So the bill in 2016 added gender identity to public accommodations laws and eliminated this exception in the sense that it specifically said, if you have a public accommodation with a part of it that is segregated by sex, you must allow individuals to access that segregated space based on how they identify. They to use the spot that they want to use. Whether that's, Curves, a women's only fitness center, or women's shelter, what have you. Now, what is the legal definition of gender identity in Massachusetts? It's very broad, and we believe it's ripe for abuse. That someone who doesn't actually identify with the opposite sex could claim to do so and abuse this opportunity to enter into particularly women's private spaces. And that's a concern. It's very vague because it doesn't require surgery. A lot of people I talk to think that in order to have a gender identity, you have to have the surgery. It doesn't require surgery. It doesn't require hormone treatments. It doesn't require a medical diagnosis. It doesn't require that you dress in a certain way to signal what your gender identity is. It doesn't even require consistency. So yes, per the law, someone could identify one gender today and a separate gender tomorrow. All it requires is that the identity be sincerely held. And I would posit to you that there's really no way to enforce that, certainly not in a short amount of time where if you've got a woman or a young girl in a locker room at the YMCA and a man comes in, or someone who, however they identify, has a male body and male genitalia. If that woman or child complains, the way this law works is that the complainant now is potentially a civil rights violator. And that male body, if they claim to be a female, has every right to be in that locker room, bathroom, shower, changing room, regardless of whether the biological women in there are uncomfortable or complain because of that presence. Now, we've seen examples of this happening, again, even before the 2016 law was passed, because as Dr. Bradley mentioned, Boston has had this law in the books for a while now. And back in 2010, a 60-year-old man who identifies as Brenda Vernikoff, but is anatomically male, was in the women's restroom of a women's shelter in Boston. And he was asked by the women in that shelter to leave, because they were not comfortable with him in their bathroom. And as you can imagine, some of these women may have been victims of domestic violence at the hands of men, and now they're in a shelter, and there is a male body, again, regardless of how the male body identifies, there's a male body in their bathroom, and they ask that person to leave, and the person refuses. So then the management of the shelter asks him to leave, and he still refuses, so they call the Boston cops. And they come, and they arrest him for disorderly conduct. But there's a lawsuit, and the city of Boston ends up paying this individual $20,000 because under the Boston ordinance, which is similar to the law that we now have statewide, he had every right to be in that women's bathroom, in the women's shelter, because he identified as female. And the shelter then had to pay a $10,000 fine as well later on. This scenario can now play out all across the Commonwealth, and there's already at least one other single-sex shelter that is currently being sued at the Massachusetts Commission Against Discrimination for a gender identity claim. And it's important not to forget the fines that were paid in that case, because since the current law is essentially adding gender identity to existing non-discrimination and civil rights laws, there are pretty severe financial and criminal penalties. If I, for example, my daughter's changing in the YMCA locker room to swim lessons, and I'm waiting outside in the hallway for her to finish and come out, and I see a man, or what looks like a man to me, Adam's apple, slightly larger hands, walking towards the women's room, and I kind of say, "Excuse me, sir, I need you to wait until my daughter's done." I'm now impeding his full access and enjoyment of that public accommodation, and I'm in violation of the law. And repeat offenses could send me to jail for up to a year and cause me to be fined upwards of $50,000. So there are pretty severe penalties on this law. Now, in 2016, just to kind of give you the mentality of some of the politicians who passed this bill, in 2016, a group that I was working with to fight this legislation had a rally at the State House. We had a speaker who was a victim of sexual assault by a man when she was young, and she made the point that, look, again, if I'm in a public shower or in the bathroom or locker room and a male body enters, I'm not going to be comfortable. And we have men's rooms and women's rooms so that women and men can be comfortable in those separate spaces. And the response from the then Senate President, Stan Rosenberg, said, the suggestion that passage of the public accommodations bill will bring an unwanted male presence into women's rooms is erroneous. Transgender men are men, and transgender women are women. What he's saying by that is that a transgender woman, so a male body, X and Y chromosome, male genitalia, that identifies as female, is a woman. And the way the law works, he's correct. But what is he saying to that woman who is the victim of domestic violence, who is saying she is not comfortable with that male body in that close proximity when she may be undressed? Completely dismissing those claims. And that's one of the reasons why I'm fighting against this law, because what this law does is it silences women. Another example, I got a call from a dad that I know. His daughter was on the crew team for a school that was competing in the Head of the Charles Regatta. And she had won a spot as a sophomore on the varsity girls team. Very excited to run in the regatta. But then she finds out that an older male classmate that identified as female was taking her slot. Because, not surprisingly, a 16-year-old male has certain physical advantages over a 14-year-old female. But he identified as female. So the dad said, look, what am I going to do? My daughter's working hard to be on this team. Can you help me? I said, well, technically, the Head of the Charles Regatta is a public accommodation under Massachusetts law. So even if the organizers of the race wanted to enforce the girls' team has to be all girls, biological girls, so that it's fair, they would be in violation of the law. What we can do is make a public statement. People need to understand that this is one of the ramifications of this law. Your daughter, I know her, she's smart and well-spoken, and she's a hard worker. She should tell her story. He said, well, no, she can't do that. I mean, she'd get eaten alive by her classmates and her teachers. She can't speak out. I said, well, or what about you? You're a father. I mean, I understand high school, it's tough. What about you? You speak out and tell her story. Well, I can't. I'd lose my job. And he's probably right. So that story doesn't get told. There's another story which needs to be told. It hasn't been yet. It's very similar to what happened in Ontario, which again, you can Google this. It's called the Mad Waxer. It was a spa, a beauty spa. And look, I've been following this issue since 2012. And this surprised me. I didn't see this coming. There was a spa in Ontario where a man came and wanted a Brazilian bikini wax. Which again, I didn't know what that was until the story came out. But it's an intimate procedure, put it that way. Okay. And the woman who was the spa worker politely declined to give this man the Brazilian bikini wax because she did not want to touch male genitalia in that way. But the man identified as a woman, so under the Ontario law, which is identical to the Massachusetts law, he has a right to have these same services and be treated the same way in that public accommodation of the spa as any other woman, because he identifies as a woman. So he is now suing that spa, and again, it's the exact same thing that happened in Massachusetts. He is suing that spa and said, look, basically that woman needs to do to him what he wants done or she's going to lose her job. And he'll probably win. And that same thing could happen here in Massachusetts. So there's a lot of unintended consequences that I don't think Dr. Deborah here wants that are the result of this law, because men in particular are taking advantage of it. But it's important to remember that the concerns about discrimination in the other parts of public accommodations, the non-bathroom, non-locker room, non-shower areas, restaurants, hospitals, those are already covered under Massachusetts law. Another thing that was frustrating during the debate over this law was that there was an amendment proposed that would have exempted registered sex offenders. So level 2 and level 3 sex offenders would not have been allowed to use this law. So if you're a registered sex offender, you cannot use the women's room even if you identify as female. That was voted down. It was barely even debated. There is a study that was done about policies in Target, right, the store Target. My wife's from Minnesota, so she wouldn't move to Massachusetts, and so there's at least one Target in Massachusetts, and there aren't. But there was a study done on the effects of their policy, because they instituted a similar policy nationwide in other stores around the same time, 2016. And what that study found was that there is a dramatic increase in peeping toms and upskirting. Not because there are transgender people doing this, but because men know that now they can get into a woman's locker room or changing room or bathroom, and people aren't going to ask questions. And so, they're still breaking the law once they start taking pictures or if they assault somebody, but it gets them all the way up to that point. The law basically says, all right, guys, you can look, but not touch. Because until they touch, now women have no right to complain or take a picture. So, last part, and I'll take questions. Maybe I'm already out of time. One last thing I know will be asked: what happens if the law is repealed? Things go back to the way they were in 2016. People with gender identity issues that have their rights already protected by Massachusetts law. The only issue is the bathrooms and locker rooms. And I think what would happen is what happened before 2016 is that people use the bathrooms that make sense for them. And in most cases, it's probably not an issue. And store owners and business owners and public accommodations get to implement the policies that work best for them and for their clientele. And the most important part is that women's voices aren't silenced by a law that would punish them criminally and financially for saying something that, under the current law, they're not allowed to say.
Thank you very much. I will open it up to questions. Go ahead.
Two questions. One is, how many signatures were on this ballot initiative?
The total is about 55,000.
Okay,
It's required to be 37,000 to get it
okay.
as a ballot question.
32,275.
Oh, I thought it was 37.
32 is
Okay.
was the
Close
first
Close
one.
enough.
Because it's a
Yeah.
repeal, it's less than the second question, which we sort of start from scratch. It's the way the law.
My second question is, your argument is based on a very few words, which is a person's sincerely held gender-related identity. How would you change this law to fix the problem you're presenting?
Yeah, that's a good question. Right now, I think it's clearly too broad. North Carolina had a law that required the full surgery in order to get your driver's license changed. So that would kind of be the opposite extreme. But something that's less easy to abuse. I mean, right now, I could, dressed as I am, with my deep voice and never having identified before, walk right into a woman's room and say identify as a female, and that's it. So it has to be something more concrete than that.
Do you have any comments about how this could be tightened up a little bit to avoid what seems to be a fairly rare threat to the, but maybe, I don't know how many instances there are of this.
No, my main concern is that the opposition is trying to link transgender people with sexual predators, and there is no link.
But we're not. We're not.
And, discrimination is discrimination, and people, if they're discriminated against, in applying to college, or if they're discriminated against, if they're humiliated and turned away from a business, those cases are going to always exist. I know this case in a little bit in Canada, and the wax, I think, was a Muslim woman, and couldn't touch because of her religious beliefs. So there are all these, they're hypothetical. It does.
So she should be forced
but
to do that procedure.
no.
Okay, but that's what this law does. That's what this. If that situation happened in Massachusetts, she would be forced by law to do that procedure or lose her job, because if she doesn't render him the same services as all the other women, that is unlawful discrimination.
She has religious rights.
She does.
So what if she's not a Muslim? What if she's just a woman who's not comfortable touching another man's
That's
penis?
another story, but.
So that woman should be forced to do
You
it.
didn't give us the full information, but,
But should it matter?
I mean, it's,
Should it matter?
I understand.
No, should it matter though?
I understand the counter discrimination threat. You've spoken eloquently on that. I just wonder how prevalent it is and whether a slight modification of this law could help with that. I just, and it's not something that we can accomplish. But anyway, I
But
won't.
And that actually raises a good point that procedurally, the way the repeal works is you don't get to repeal part of it or amend it.
Right.
It's all or nothing. So the only option we had was to repeal the whole thing.
So you're saying that because of basically, and I'm probably limiting this and trying to take in a lot of information that you just threw out there, because of basically 6 instances, you want to limit the 35,000 people who follow the rules, who are who they are, who are decent people, and discriminate against them, as opposed to the priests, the congressmen, the different people out there who are constantly violating people and are getting away with it. I don't understand that. I don't understand why going to a bathroom, into a bathroom, is like, when my daughter went to college, they had boys and girls on the same floor, they shared the same bathrooms. They were stalls, you went into a stall, you used the stall. I mean, granted, you may feel a little bit uncomfortable, but in a situation like that, most people are not getting undressed. Of course, it's been a few years since I've been in a locker room, in front of everybody. And if you feel that way, you'll be self-conscious anyway. I just feel that you can't limit who these people are when they have so much against them already. There's so many incidences that every day that I'm sure they come up against, and there's nothing they can do about it. You know, it boils down to having a cake made for your wedding, that you can't get a cake made because of someone's beliefs or whatever. I don't understand how the majority of the people we're talking about are decent human beings. Granted, there are people out there who aren't and who would take advantage of the situation, but there are people out there who are not transgender, who take advantage of the situation, who stalk people, who follow them into bathrooms when they know there's no one else in there but that kid.
And that's the group we're concerned about. The first group, folks who identify as transgender, that's, you know, they're doing it consistently. I mean, they're not making it up. The way the law is in Massachusetts, if this law is repealed, their rights don't change. The only area where there's change is in this, you know, single-sex facilities like bathrooms and locker rooms. And I think there's enough of a safety concern there that we need to repeal the law. And I think for the 33,000 adults who identify as transgender, if they're not causing problems, not making people feel uncomfortable, there's not going to be an issue. The concern is that you have a man who is abusing this law, go into the women's locker room, just take a long time putting on his socks, eyeballing everybody. And this actually happened out in Washington State where they had a similar local ordinance. It was on a college campus. He was in the women's locker room at the college campus, and a girls' high school team came in. It was volleyball or something, maybe a swim team. And he was just hanging out in the sauna, completely male. But he identifies female, and so when these high school girls complained, the school said there's nothing they could do. That's the scenario we're trying to prevent, where there's, you know, particularly guys taking advantage of this law.
I have to say that when you look at the information available in the 18 states who've had these protections, and Massachusetts who's had these protections in 2 years, there are not people going into restrooms and locker rooms and committing crimes and saying that they're transgender. They're not using transgender as a defense. And I think that that you cannot put civil rights for people up to a popular vote. This is a very slippery slope we're dealing with here. There are always going to be people who are discriminated against. There are always going to be people who are going to cry discrimination, and that's to be settled in court. I'm going to just leave it at that. It's getting late.
It's just another comment. I think Phyllis Schlafly helped to kill ERA on bathroom scares when it was almost certainly going to pass. And So I'm hearing echoes of that coming through here. I don't see why you need to repeal the law as opposed to refine it. And I mean, you're making perfectly valid statements, but in order to give your examples, you're going to Washington State, you're going to Toronto, because there aren't very many examples, apparently. So what I'm just saying is, it just needs to be refined. These people have to establish their identity a little more formally. Something like that. I don't know.
If we repeal the law, the voters repeal the law, I'm sure the legislature would, right back at the beginning of this upcoming session, almost as fast as they voted themselves a pay raise, put something else in place that had those refinements. Unfortunately, there is no procedure
That's
to
not
do
guaranteed.
well.
But they can still refine this law whether, if we vote yes, they
But
can still refine the law.
I don't think they will unless the voters speak on it.
Well, that would be your job to go and advocate.
Yes.
If that's-
Will you join me? I could use some help up
I
there.
won't.
And you know, and you know, these 30,000 people in Massachusetts, where do you think they've been going to the bathroom all along?
Well, and that's my point. I don't think that's going to change if this
They
law is
need
repealed.
protection in public places.
But they have it.
My daughter was discriminated against in an emergency room when she gave her complete medical history.
Did she file a complaint with MCAT?
No, she wouldn't do
But
that.
that's all this law is to file.
And she
That's how the law
got
works.
discriminated against in public transportation. So maybe they should sit at the back of the bus.
Yeah, or have separate drinking fountains because they're different.
Maybe I haven't been clear, folks, but all I'm talking about are intimate spaces where women who have talked to me, but who are afraid to tell their story publicly because of the type of backlash that comes against them. And in this era of the Me Too movement, what we're going through this current week as a nation on these issues, I think women should be listened to. And if they're not comfortable because of male bodies in intimate spaces, I think that's a valid concern. That's all I'm talking about. I tried to present right at the beginning that the existing law in Massachusetts pretty thoroughly protects people with gender identities in all the other areas, including public accommodations, except for bathrooms. I mean, if a biological woman who identifies as male can sue Bay State Health because they weren't sure they had the expertise to artificially inseminate her and win prior to this being passed, I mean, those rights are covered.
What bathroom would you have to use?
What's that?
What bathroom would you have to use?
No, I think in general, people should use the bathroom that's consistent with their body. That's why we have separate bathrooms. Not because of gender identities, but because of distinct male and female bodies. But in general, I think people are going to use the bathroom they're comfortable with, and unless it creates a problem for someone else.
Sir, I disagree. I think one thing that really woke me up about this was the National Geographic showing that there's like, a dozen different variations on our sexuality. I don't know if you people saw the front cover of it. It's just absolutely amazing. There is no real binary system here. There is no just exactly.
So why do we have men and women's bathrooms? Should we just get rid of those then?
Yes.
Yeah. That may be the better way to do it.
There is no reason not to get rid of individual use male and female bathrooms. The only people who are hurt by that is the urinal manufacturers. Really. Now, when you're talking about a situation like you're talking about, locker rooms, and it's much more complicated.
And that's really where the concern is. I mean, individual use bathrooms, I don't think anyone's making any complaints about those. It's really these instances where you have, I mean, we believe in rights for everybody, right? So the 22-year-old young woman has a right to privacy and modesty, and the 22-year-old male who identifies as female who wants to use that same space has rights. But those two rights are in conflict. So how do you resolve that? And what this law says is the way we resolve it is we tell the biological female is not comfortable to be quiet. And I don't think that's right.
I think that there's a transition going on at the present. There's a transition in attitudes. Like, for instance, you were saying the kids in school now who are going to college together and they all live in the dorms and they have one bathroom area and they're all using this bathroom and they don't really care.
Well, some colleges, but not all colleges like that. Gordon College down the street isn't like that.
No, I'm sure
But are there concerns and rights? Are there concerns and rights not valid? I mean, you're willing to give the Muslim spa worker and protect her rights. What about the kids at Gordon College?
You gotta learn too. You gotta change.
So just to be clear, we want the Muslim spa worker and the Christian spa worker both to have to touch the man's penis because the man identifies as female.
We don't have to bring it to that level.
But that's where it is. That's what this law does. That's one of the, I think, one of the unintended consequences.
No,
of the law.
no.
Individual in another country.
Okay, so there's 30,000 in Massachusetts, you're probably talking millions of people between Canada and the United States.
Well, if we're gonna base rights on the numbers of the individual, then that shifts the whole balance the opposite direction. But I don't think that's what you want to do, right?
Well, I think we need to sort of end this. It's already 9:15. I know we're all tired. I want to say thank you so much for being here.
Thank you.